Welcome. Today we're diving deep into a topic that's just so central to every nurse's journey, maternity and women's health care. This isn't just theory from a book. It's about real people, actual families, and the absolutely vital role you, as future nurses, are going to play. We pulled together a whole stack of insights from your sources, really giving a comprehensive look at the foundations of nursing care for childbearing families, our mission, basically, to boil down the most important bits about where maternal infant care is today, the nursing process, and why all this stuff really matters for your practice.
Indeed. And what's fascinating, I think, is how the history, the whole backstory of maternity care has really shaped today's practices, and how your role as a nurse is so central to providing high-quality, truly family-centered care. We'll look at the evolution, the current trends, and those specific nursing interventions that are just essential.
Okay, let's unpack that journey then. Your sources kick things off by highlighting some pretty major shifts in maternity care over, the last 50 years or so. What's the big picture change, the thing that really transformed how we view and manage childbirth?
Well, historically, childbirth was mainly a home thing, often attended by women known as granny midwives, who were really part of the community fabric. The huge shift was the move into hospitals. That was driven by, medical advances and making healthcare more formal. So you saw a transition from those traditional midwives to a more, let's say, medicalized, doctor-led system. Now, initially, this did bring about dramatic drops in maternal and infant deaths, a huge public health win, really. But it also it made the experience more clinical, maybe less personal for families. And unfortunately, we still grapple with some stubborn disparities that emerged from those changes.
Okay, so that was the initial shift. What does that mean for how care is approached now, especially thinking about the patient's experience?
Right. This gets us to a really crucial point about how we now try to care for families more holistically. That earlier shift kind of raised questions and eventually led to the development of what we call family-centered care. That's not just jargon, it's a whole philosophy. It emphasizes high-quality care that actively recognizes and adapts to both the physical and the really deep emotional needs of the whole family unit. It values things like shared decision-making, flexibility in care, and critically, it views childbirth as a normal, healthy event, not just a medical procedure. So for you as a nurse, this means really empowering the patient and their family, making them active participants in the decisions, making sure their values are respected all the way through.
That makes a lot of sense. Moving towards more personalized care, right? Where does this actually happen? Physically. Are we still talking about those old-style sterile hospital rooms where people get moved around constantly?
Oh, not at all, really. The sources specifically mention the widespread use of labor, delivery, and recovery rooms, LDRs. And actually, what's even more common now are the LDRP room, labor, delivery, recovery, and postpartum.
Yeah.
The idea is the mother stays in one single, comfortable room right from when she arrives in labor, through the birth, and during her initial recovery afterwards. For nurses, honestly, this is a game changer. It means you're not constantly shifting patients between different units. That reduces stress for the family, improves care continuity, you build a better relationship, manage a wider scope of care in one spot, and you can really involve the family more easily. It demands maybe different organizational skills, a more holistic view from the nurse. You're assessing more comprehensively across that whole period.
Right. Okay. Now let's zoom in on the data, the numbers that really define the landscape for you. As future nurses,
Yeah.
our sources get into current trends, statistics, stuff that shows where nursing efforts are most needed. What really stands out to you about maternal and infant health in the U.S. right now?
Well, if we connect this back to what we were saying earlier, despite those historical improvements, the U.S. still faces some pretty big challenges, things that really need our focus. Maternal and infant mortality rates, while, yeah, they've dropped historically, they're still stubbornly higher compared to a lot of other developed countries. Like the source mentioned 2013 figures. Infant mortality was 5.96 per 1,000 live births. Maternal mortality was 17.3 per 100,000 live births. Just picture that. For every 100,000 births, about 17 mothers didn't survive. These aren't just stats. They represent real loss and point to areas where our interventions like prenatal education, identifying who's at risk, are critical.
And the sources mentioned stark disparities too, didn't they? That's a really powerful point about the inequity.
Absolutely. The sources are very clear on this. Significant racial and ethnic disparities persist. Black and American Indian Alaska Native women, for example, face much higher maternal mortality rates compared to white women. It's a stark reality that race can literally impact survival chances in childbirth. Preterm birth rates are another big concern, though there has been a slight decline recently, which is, well, at least a positive sign. So this raises the question, what can nurses actually do about this on the ground? Your role is crucial, not just in the direct, hands-on care, but in actively advocating for health equity, pushing for public health goals. Every time you educate a patient, perform a screening, advocate for someone, you're connecting to those bigger national objectives, like the ones in Healthy People 2020. Things like reducing preventable deaths, achieving health equity, creating supportive environments. Your daily work has this larger impact. You're not just caring for one person, you're part of a bigger movement.
Okay, so let's talk more about the nurse's role then. In this really dynamic field, the sources emphasize just how broad that responsibility is.
Oh, it's incredibly varied and specialized. It demands a really deep grasp of both normal physiology and potential pathophysiology, what can go wrong. Nurses are right at the center of assessment, diagnosis, intervention, even research. You'll see different roles. RNs giving direct care, nurse practitioners, NPs doing advanced primary care, certified nurse midwives, CNMs, focusing on low-risk births, clinical nurse specialists, CNSs, acting as expert consultants, and neonatal nurse practitioners, NNPs, dealing with complex newborn needs, especially in places like the NICU. Many of these, the advanced roles, need graduate degrees, board certification. It really highlights the level of expertise needed to work safely and effectively here.
And the framework holding all this together, the nursing process, it's like nursing 101, but how does it apply specifically to the complexities of maternity and women's health?
Right. It's absolutely foundational. The nursing process is our systematic guide, that five-step cycle. Assessment, nursing diagnosis, planning, implementation, and evaluation. And each step is critical in maternal infant care, where things can change fast, and you're often caring for two patients at once, mother and baby. So first, assessment. This is all about gathering information, health history, physical exams, lab results, getting that baseline. For example, during pregnancy, you're checking vital signs, fetal heart tones, measuring the census, asking about nausea, swelling, all those signs and symptoms. Postpartum, you're assessing for bleeding, infection signs, maybe screening for postpartum depression. For the newborn, nurses do thorough checks, vitals, color, feeding, reflexes. You're constantly gathering objective and subjective data, physiological, psychosocial, cultural, looking for anything that deviates from normal, anything signaling of a potential issue, a pathophysiological process. Okay, then step two, nursing diagnosis. This is where you analyze all that assessment data. You identify the actual or potential problems that nurses are qualified to address. We use standardized language like from NAN to I, that's the North American Nursing Diagnosis Association International. It gives us a common way to talk about diagnoses. So let's say your assessment finds a patient reporting constant morning sickness, she's lost 5 kilograms, and her daily calories are way down, like under 1,500. A nursing diagnosis might be imbalanced nutrition, less than body requirements related to excessive nausea and vomiting during pregnancy. Makes sense, right? Or postpartum, maybe a mother reports pain with breastfeeding, you see cracked nipples, the baby's struggling to latch. The diagnosis could be ineffective breastfeeding related to nipple trauma and infant latch difficulties.
Got it. Diagnosis identifies the core nursing problem based on the assessment.
Exactly. Then comes planning. Once you've identified the problems, you prioritize. You set expected outcomes, things that are measurable. What do you hope to achieve with your care? And ideally, you set these goals with the patient. So for our patient with imbalanced nutrition, a goal might be patient will demonstrate adequate caloric intake and stop losing weight by the end of the shift.
Right.
More to the breastfeeding mom. Patient will report pain-free breastfeeding and show correct latch technique within 24 hours. Clear, measurable targets.
Okay, plan set. Then you act.
Right, implementation. This is where you carry out the interventions you plan, based on evidence. This is the direct nursing care part aimed at fixing the problem and meeting those goals. For the patient with nutritional issues, interventions could be counseling on calorie intake, suggesting specific foods to ease nausea, maybe small frequent meals, or even bringing in a dietitian. If it's ineffective breastfeeding, you might teach positioning, latch techniques, show how to care for nipple trauma, maybe refer her to a lactation consultant, and this is where medications fit in too. The source specifically mentions RhoGAM. This is absolutely critical. It's an injection given to Rh-negative mothers who might have an Rh-positive baby. The pathophysiology here is key. Without RhoGAM, if the mom's blood mixes with the baby's Rh-positive blood, which can happen during pregnancy or delivery, her immune system might create antibodies against that Rh factor. Now, that might not affect this baby much, but it's a huge risk for future Rh-positive pregnancies. Those maternal antibodies could attack the next baby's red blood cells, causing something called hemolytic disease of the newborn. Really serious stuff. So the nursing intervention is giving that RhoGAM shot usually around 28 weeks gestation and again after birth if the baby is Rh positive. It prevents the mother from forming those antibodies, protects future babies. Nurses are responsible for making sure it's given at the right time,
right dose, and educating the patient about why it's so important.
Wow, okay. That's a perfect example of a crucial nursing intervention tied directly to pathophysiology.
Exactly. And finally, the last step, evaluation. You assess if your interventions actually work. Did you meet the goals? You're constantly asking, how is the woman doing now? Did we achieve the outcomes we set? If the patient stopped losing weight, if the breastfeeding mom is comfortable and the baby's feeding well, great. The plan worked. If not, the process starts again. It's a cycle. You reassess, maybe refine the diagnosis, adjust the plan, try different interventions. It's all about continuous improvement.
That clarity on the nursing process, especially with those concrete examples like RoJam, is so helpful. And beyond this core process, the sources also talk about a holistic approach. What about integrating other things like complementary medicine? How does that fit in?
Yeah, that's an important point. Complementary and alternative medicine, or CAM. As a nurse, you will have patients using these therapies, sometimes alongside conventional medicine, sometimes instead of it. Your job isn't to judge, but to ensure safety and advocate for the best outcome. So you need to be aware of these practices. Things like mind-body therapies, yoga, meditation, guided imagery, which can help with stress or pain management. Manipulative therapies like massage or chiropractic care. Biological therapies, herbal remedies are common here. Think ginger for nausea, maybe ginkgo biloba, ginseng, echinacea, peppermint oil. Then there are energy therapies like Reiki, focusing on energy fields, and bioelectromagnetic therapies. It's absolutely vital that you talk openly with patients about what they're using, document it meticulously in their chart. And you need to understand potential interactions. Could that herb interfere with the prescribed medication? Could that therapy affect their condition? It's about safety and making sure all care is integrated properly. Your role is to educate, assess for safety, and communicate with the healthcare team, not necessarily to recommend or prescribe serum, but to ensure it's factored into the overall picture.
Okay, so wrapping this up, what does all this mean for you, the nursing student listening, getting ready to step into this really dynamic field?
Well, I think this deep dive really shows that maternity and women's healthcare is, yes, dynamic, it's complex, but it's also deeply human. It's about so much more than just managing symptoms. It's the whole continuum. Your ability to really master and apply the nursing process, to understand different care models like family-centered care, to recognize those health disparities and their implications, and just engage in sharp critical thinking. That's what will define your success, and it will profoundly impact the health, the well-being of countless families.
That really is a powerful thought to end on. This isn't just about clinical tasks. It's about supporting new life, empowering families, ensuring the healthiest possible start. So as you continue your studies, as you prepare for practice, maybe think about this. How will you actively contribute to narrowing those health disparities we talked about, the ones that still exist? How will you help ensure every family, no matter their background, gets the high-quality, compassionate care they absolutely deserve?